welcome to this presentation, because last time when we were actually discussing the other topic of the clinical research and informed consent, at that point of time, actually there was a need that we should also understand about the case record form. Generally, the case record form is actually one of the very important clinical trial document, because actually this is the document which is actually in black and white, which is available for the regulators, for inspectors, for auditor, monitors and ethics committee members and so many people. And this is one of the legal document where somebody can check whether the particular study which is done and the data is collected, whether really it is authentically done and whether all the data is whatever has been submitted is real. So case record form is one of the very important document in any clinical research. So it is very important for us to understand the clinical research related to case record form. Now coming to the case record form, let us just try to understand what actually it is and what is actually the definition. It is actually a printed optical and electronical document designed to record all of the protocol requirement information to be reported to the sponsor on each trial participant. And this is as per the GCP guideline section 1.11. So this is actually the basic definition of case record form. Now actually what we understand by the case record form. Actually this is the form which is used to record the patient data obtained during the clinical trial study, or collectively called as the case record form. So this is the form which is available to the investigating site to enter all the data which are generated during clinical trial from the patient. Now, it's very important for us to understand actually what is the purpose of actually collecting data in case record form. Usually there are so many, but if you really go into that main thing, there are two main important purposes why we collect the data in case record form. The first one is to answer the hypothesis formulated in the study protocol. As we know that we start any clinical research with a hypothesis. So to answer that hypothesis, actually we record the data in a case record form. This is actually the first main objective. The second one, which is very important, and probably this is one of the most important thing as far as the regulator is concerned. They wanted to say that whatever actually data you have recorded, what about the safety issue? Whether there are some problem appeared during the clinical trial, some ADR has happened or something went wrong. So these are the two main reasons why we record the data into the case record form. One is the safety and other to answer our hypothesis. Now what is the role of case record form in entire actually activity of clinical research? The case record form plays a very vital role in collection and extraction of the data, because we collect the data and then we extract the data to come to a final conclusion, because based on the case record form only we conclude, yes, this drug is effective, not effective, it is very safe or so. That is the first role of the case record form. Second is that the design should ensure that there is a precise collection, collation, analysis and recording of the data. So this is very, very important that every small part of the data which is collected into case record form should be very, very precise, and it is collated. You are able to correlate between the two data which is analyzed, and finally when it is going for the analysis, the analytical person should be able to properly analyze, and then he can make a final record. And lastly, the most important thing, the role of case record form is that accuracy of the data is of paramount importance. We find across in the literature that there are many reports which appear that the data was not properly entered, and subsequently they found that there was some wrong data appeared, and due to that the various future problems has appeared. So accuracy of the data is paramount important as the role of case record form. So these are the three very, very important things one has to understand why case record form is required and its role. Now, actually case record forms are there. There are many players, those who are actually playing the clinical research game. So this is significant to whom? Who are the people, those who are actually are responsible to have the case record form, try to understand, use it and try to interpret. Now let us see who are the people. The first and the foremost thing is that it is the investigator, because as we know from our knowledge that the investigator is the most important person responsible for any good or bad in clinical research. So case record form is very, very important document for the investigator. The second thing is that the monitor, because monitor they go at the site to check what is actually there. So they check the case record form and check the accuracy, whether the data is properly entered, and they also see the consistency, whether the report which is submitted from the biochemical department or something is there is a consistency in the report. So monitor are the second person, those who are very, very important and significant for their case record form. Then the third is the data manager, because he has to finally manage the data and prepare the database. Based on that, the report are generated and we get a conclusion. So the data manager is the third person whom CRF is significant. And most important thing is the regulator, because regulator, they always ask, we would like to see the case record form of each and every participant to check whether data is properly entered or not. So these are the people for whom the case record form is most significant document. Now coming to designing of the case record form, it is art as well as science. So what is the importance of well-designed case record form? Because if the case record form is not very well planned, very well designed, then all the data, everything will be very, very difficult to analyze and it will almost become useless. So designing of a very good case record form is very, very important. Why? Because it ensures the consistency across the participant. Now in a clinical trial, there may be 50 participants participating, or in a multicentric there may be 100, then there may be 1,000. So the case record form is the only document actually which provides a absolute consistency between all the participants. This is the first important reason of designing a well case record form. Second thing is that every case record form is designed in such a manner that it is very clear, there is no confusion, and it is very easy for investigator and other people to understand. The third thing is that efficient for data management processing. When the case record forms are sent to data managing processing people, it should be efficient. It is very clear for them. There should not be any confusion. This is only possible when your designing of the case record form is very well done. And appropriate, consistent, reliable, and there should be clean data for analysis. So these are actually some of the property of well-designed case record form. And definitely now all the people are using actually computerization. They enter the hard copy of data for computerization for analysis. So the well-designed case record form should be easily put into computer data and analysis can be done. Now you have to remember three very important principles for designing a very good case record form. And all these actually having what is known as 3C. What is first C? That it should be very, very clear. There should not be any confusion in any part of the case record form. Second thing, it should be very concise. It should not be so elaborative that it is very difficult somebody to read or to understand. And the third C is that it must be consistent. Whenever somebody is checking, always everybody should interpret in a very same manner. So always remember, for a better designing of the case record form, 3C is important. It should be clear, it should be concise, it should be consistent. Now the things comes actually the timing of designing the process. Actually, when you think of designing a case record form, actually the first and foremost during the protocol development, now we have decided that we want to do a particular clinical trial. The first and foremost document actually we want to develop a protocol. So during the development of a protocol, what is that? Identification of the problem with protocol procedure prior to protocol finalization. So whenever you are finalizing a protocol, you should clearly identify, okay, this is my problem, which actually I wanted to put in a protocol and try to develop a procedure. Second thing is that we always remember that there is not a single protocol or there is not a single case record form. There are so many versions of case record form may be necessary. So during the protocol development itself, you will find out that you have developed one protocol. There are some changes. There is second version, third version. So there will be change in the version. And once actually you have designed a draft protocol, after that the protocol is actually comes to the stage of finalization. When you are coming to the stage of finalization, few versions of case record form or fewer review for the poor actually finalization. There are 4 or 5 actually case record form will come for the finalization, and ultimately you are going to finalize the one. So during finalization itself also there may be possibility that you may get more than one case record form, and the issue between the case record form, data, protocol arising, protocol amendment, all will be required. You are doing a study during a very good protocol, but due to some reason, some new thing appear. You have to amend the protocol. So amendment of the protocol also has to be considered during the finalization. So you can also think that, okay, when the study is going on, there are some issues will appear, and protocol amendment also will be necessary. Then now come to a real, actually the activity, the process of preparation of the case record form. How actually you proceed to develop a protocol. First, actually, we have to have team those who are involved in preparing a case record form. Always a single person or two person, they cannot develop a case record form. We need a team of the people, and who are actually in the team. The first person is that who is actually designing a case record form. We need a designer because it is an art. Second, we need a medical advisor because in case record form, there are so many medical issues are there. So we must have a qualified person who is very well trained in that particular area of clinical research. For example, you are doing a study in cancer. Naturally, I need a medical advisor who is trained in a cancer or diabetes. So the second person which must be in the team is the medical advisor. Definitely I need a clinical monitor because he is going to the site and he is going to do so many monitoring. So he should also be a part in developing or preparing case record form. Then data entry leader, because data entry leader is very important because he is entering data. So suppose you have designed some case record form, it will be very difficult for him to enter a particular type of data. So you have to involve him since the beginning, then he will be able to tell, no, the data should be like that, so it will be, entry will be. So the fourth person in a team is the data entry leader. And the last is the data manager because he is going to manage the entire data. And definitely we have to consult a statistician before planning any research and the case record form. What type of data should be entered, whether it will be numerical data or it may be tick mark or what type of thing that statistician will be able to do. So these are the mainly people those should involve in team in preparing the case record form. There are so many other people are there, but these six people must be there when we are designing any case record form for any clinical research. Now coming to very important thing which you have to understand, that as far as the regulatory things are there, what is their requirement? What they wanted to have in case record form and what is they always consider and they look into that whenever inspector is coming or audit is going on. Regulators are very particular to look into requirement of that. One, they always check that your case record form or protocol must comply with the ICH good clinical practice guideline. If there is some deviation from the guideline, they will reject your case record form. So you should be very careful that all case record form designing has to consider the GCP practices. Second thing, must adhere to the specific requirement of the regulatory authority of the country in which the clinical trial is done. We know that there are different additional regulatory requirements are there in different countries. If you want to do in Australia, there are something additional. In your doing in India, there are something different. Like the audio-visual recording is one of the requirement in actually country like India. So you must to adhere to a specific requirement for particular regulatory authority when you are doing that study depending on the country. So you should also know that rules and regulation which are beyond ICH GCP which is required for a particular country to be considered when you are preparing a case record form. So these are two very important regulatory requirements. Otherwise, the case record form will be rejected. Now, actually, process of generation of case record form, how it happens, what are the various steps. The first is that the project leader initiate, the person actually who is really preparing that, okay, the study should be like that, actually he initiate the process by issuing a request for preparation of case record form of the study. So he has got a thinking that such and such a study should be done with such and such drug in a particular disease. So he initiate and prepare a request that I would like to do a study. These are the patients, so many patients I wanted to do. I want to use this drug. I wanted to do like that. And then actually he requests for the development of case record form for a particular study. Actually review the request to ascertain what data element needed to capture to satisfy the protocol requirement, because he has got only idea that the project leader is asking me to do this study and all those things. So he confirmed that what data element is required, what are the type of data has to be included into the case record form. Blood pressure is required, or you want to do some investigation, or you want to use some other type of scale. Everything he has to capture, and they try to satisfy the protocol requirement, prepare it, and again go back and he asks that these are the document I am preparing and these are the actually element or preparation has to be completed like that. And then third thing is that the case designer develops a case record skeleton plan. This is actually nothing but a very simple draft, and he shows to visitor and each associated assessment. All the people, they actually go through this case record form, which is just like a skeleton thing is there in a draft, and everybody again go through and they analyze that whether these are okay or there is some additional requirement is done. Then the team again meets and all the study members approve the skeleton. Everybody I listed that the all 6 people, they again sit and see that whether the skeletal plan which was designed by the designer, is it okay or there are some changes are there, and if they think everything is fine, then only they approve. Then the designer next details the requirement of protocol into very clear, simple, unambiguous questions and create an appropriate area for data to be recorded. Then really he makes a very final case record form, including very clearly what is there in a very simple form, no confusion, all the questions which is needed to be recorded from the patient, all he prepares and he creates an appropriate area data for the recording. So then there will be a final case record form is designed by the designer. Then again there is a review by the team, review content of the draft case record form and create a list of changes if appropriate. So each and every component of case record form is again reviewed, and if they are okay, then they say okay. But if there are some changes which are appropriate, again they do the changes in the draft case record form and then they approve for the final case record form. That incorporation input of the study team of the content in case record form is finalized. Then all of them, they sit and they say that all these changes which we have made is okay, now this is final. And once it is finalized, then review physician layout and the case record form assess completeness, appropriateness, inclusion, review team recommendation. This actually also has to be done in writing. Everybody should write that all the case record form we have checked and we found that layout is perfectly all right. There is no change and everybody sign and date. Then only it goes further for case record form actually approved and finalized and dated by all the people, those who are involved. And then actually it is finalized by the project leader. Ultimately, the project leader gives the final approval of the case record form, and then the case record form is given version, control document as a protocol and ICF, because there is a protocol has got the version, there is an informed consent that also has got the version and date. Similarly, the case record form should also have the same version of protocol and ICF. Suppose protocol has version number 2, ICF has version number 2. So the final case record form should have the same version. So this is actually the final thing which actually case record form is there, which is very similar to protocol and the ICF in the form of version and date. And then actually the designer should ensure when everything is there, the designer again check into that the request precise information required by the protocol is there or not. He recheck that protocol is asking following things, which all these things are there in my case record form or not. Request the information in such a way that the completion is very simple, relatively very quick and unambiguous as possible. So he looks into that and he runs a dummy run, whether it is very simple, whether very quickly it can be done, whether there is any confusion, just he does a mock run to see the case record form filling and they present the information very clearly in a logical sequence, and uniformity is very, very important. To ensure the integrity of case record form, because there are so many case record form, some case record form may come to you for evaluation. How you see that integrity is okay? So how to ensure the integrity of case record form which is actually submitted to anybody for check? First, actually it must have unique participant identification subject number. There must be case record form number and subject initial. Number 2, the name of the sponsor, who is actually sponsoring, the pharma industry, company responsible for trial, it must be there on the case record form as well as on protocol. Identification of the trial, it's a unique study number. Each clinical trial has got its unique study number that should tally. Visit number at each assessment. Suppose there are 6 visits. So there definitely visit number 1, visit number 2, visit number 3. It should be very, very clearly mentioned in the case record form. That is one of the very important things one has to ensure. Study day, assessment and reference. There are different type of study. Some studies are in days, some are in weeks, some are in months. And assessment reference, when the assessment will be done. So all these things should be ensured whether they are present in the case record form or not. Page number identification is very, very important. Each protocol, each case record form must have the page number, and page number should be like that. That is page number 6 of 52. That means I know that my case record form is having total 52 pages, and out of that the page which I am seeing is number 6. So this is the way the page number should be put rather than putting 1, 2, 3, 4, 5, 52. No, that is not correct. You have to put page number 1 of 52, 6 of 52. This is the correct. So if there is any page is missing or somebody had deleted, I will come to know. Additional event distribution of copy. You should have a additional eventual distribution of copy additionally required for the case record form in emergency if somebody wants to check. This is one of the example which should be there in case record form. I don't want to go in detail because you may be coming across various case record form. These are the things which are there, that telephone number, fax number of investigator, subject number, protocol, which I cite, I was telling subject initial. These are must to ensure that protocol is filed. Then actually version control number, I have already told, it must be having version and date. Always it should be mentioned confidential because only few people are authorized to see the case record form. And as I told you, this is the way there should be page. Then coming to the other detailed content of case record form. The case record form protocol driven must contain section on what? Study number, center code, patient number. Name and signature of investigator is a must on case record form. Version date, page number. Emergency number, this is very important in case record form. If somebody actually develops any problem or there is some emergency to contact an individual about any answer, there must be an emergency number available on the case record form. Instruction of filling, this is another very important thing. Many times we found that the case record form is given to us, but there is no instruction how to enter, because whether I should put tick mark or I should underline or I should actually make a circle, what to do, what not to do, where actually I have to enter on the left side the mark or right side. So instruction of the filling of the case record form should be a separate document. It should be given along with the case record form. Study flow chart is very important because I should know when actually is the next visit of the individual. At that point of time, what are the things I have to do? So flow chart has to be a part of case record form. Inclusion exclusion criteria, definitely it will be there. It is most important. Demographic of patient, medical history of patient, concomitant medication and previous therapy. These are all the components will be present in any case record form for any clinical trial. Current illness, sign and symptom and diagnosis, study medication and dosing detail. You have to very clearly write that what study medication the volunteer has to use, what is the dosing, how many times he has to use a tablet and capsule, whether he should use empty stomach or he should use with milk, before meal, after meal, every detail should be given. This should be given in much detail in the heading of the study medication and dosing detail. Then general examination are the part of case record form. All the lab investigation which are required has to be there on a separate sheet. Special examination, you are doing CT, MRI or any other special examination, that should be mentioned separately on separate sheet. Adverse event monitoring reporting is one of the most important part of case record form, and there is a definite guideline and there is a definite document specification as per each regulatory authority that has to be enclosed. So there is a ready-made adverse event reporting form is available, one can download, and that should be part of all case record form. Serious adverse event reporting also is a document which is available. It should be part of case record form. Compliance check. When actually the volunteer or participant is coming, how you are checking the compliance about use of their drug, that should be one page in case record form. Efficacy parameter, naturally that will depend on the type of study. What are your efficacy parameter, whether it is a blood pressure or blood sugar level or serum creatinine, whatever may be there, that is your efficacy parameter. That depends on the type of clinical study you are doing. Then safety parameters are very, very important, and there should be a checklist, because whenever you are doing any clinical trial, you know that what drug you are using, what standard you are using, and it is very well known that this new drug is known to produce following side effect, or this standard drug is known to produce so many parameters. So there should be a checklist. Whenever the participant comes, you have to ask about that, whether he is developing any of the parameters or not. So safety parameter checklist should be part of each case record form, and it has to be entered during each visit. Then end of the visit information, there should be clearly written when actually the study will be ending. What is the last visit the volunteer or participant has to come, that also should be mentioned on the last page of case record form. Now we should come to the layout, because this is the art, because different way you can print and you can prepare. But it is very, very important that if you really want to do a very good international level clinical trial, actually your case record form will tell whether really you are a qualified or experienced clinical researcher, depending on the layout by which you have prepared your case record form. Case record form should be easily read and understood. Anybody, if you give to him, he should read very easily and can understand. He will not ask any question. Should be sequenced and formatted uniformly all throughout, regularly, one after the other. What is the event is going to happen, that should be at least formulated. Encouraging the investigator comment in right place. In each case record form, you should provide a very specific area for the investigator to put his comment and remark. Many times we see that case record form are very nicely designed, but when we are actually filling some issue comes, there is no place. We will be writing on either on the bottom or the top of this thing. There should be a clear specified area mentioning investigator remark. That should be given, so I can put my remark, such and such happened, or the volunteer was not able to answer some, whatever may be there, but there should be a remark column available on the case record form in particular place. Choosing a readable format. Don't prepare a case record form where actually I want to use a lens to see that. So it should be very clearly visible. Not because people are telling that if I increasing the font size, the number of page will increase. I agree, but don't actually make very small only to reduce the number of pages and prevent your money. It should be having a proper font. And what is actually the choosing the appropriate font size is very, very important. And there are regulatory requirements also that what should be the font size. Uniformity of layout is very, very important. Complete case record form should have a very uniform layout from page number 1 to last page. Example, procedure to be completed at each visit. When the volunteer or participant is coming to particular visit, there should be complete procedure that what are the things during that visit has to be entered into the case record form. For example, here, these all are there. Suppose vital sign, body surface, all these things should be documented that these are the things has to be administered or entered into the case record form in a particular visit. Visit number 1, these things are entered. Probably on the visit number 3, you may not be requiring all, probably you may not be doing this investigation. So every visit, what are the things has to be entered into case record form should be enlisted very, very clearly. Just a minute, please. Hello? Hello? Yeah, I actually just called to tell you one thing, sir. Actually, we are working with LV Prasad Eye Hospital for our zebrafish. So, Dr. Indumati Madam, I sent one small protocol. She just wanted one actually video conferencing with us. We are planning on Wednesday 11 o'clock. I just want to inform you. Oh, just I want to inform you because she's telling need not to come there on video conferencing. She will be able to explain me. I just wanted to inform you. Okay, thank you very much. Sorry. Now, after actually this all thing is there, the person actually who is completing the case record form, for him, there should be very clear instruction, whether investigator or other, because most of the time, actually the person who is appointed by the investigator is the clinical research associate, he enters. So there should be instruction for completion of clinical trial. Every CRF should have provide precise but sufficient information for the investigator, a flow chart, table of the content at the beginning is ready reference for him. So investigator wanted to check particular thing, immediately he can go to index table and he can check, okay, on page number such and such, this thing is there, he goes to that page number and refers. General instruction on page, visit specific instruction if required should also be presented. So in a particular page, suppose there is some specific instruction is required, that should be written on the bottom. Actually, probable data management actually queries should be kept in mind while designing a case record form. Instruction for filling the case record form is also very, very important and essential. Enter the patient number in case record form. This is one of the very common actually fault. The inspector as well as auditor, they found that case record form is perfectly filled. Everything is there, but actually the patient number is missing. So this should be very careful that every case record form, there should be a proper identification of a patient number. Ensure the patient number in the case record form correspond to the study medication packaging. Now, for each actually participant, we prepare one medication package number 72. We give 72 to only the patient number 72, and that should be entered into case record form. Many times they found that the patient number is given 72, package issued is 65. So this should not happen. It should tally. Use only standard abbreviation. If you go to literature, there are standard abbreviations only are available, and whenever you are designing case record form, don't use your own actually abbreviation. Always use a standard abbreviation because your case record form may be going to international review to various countries. So there is a uniform abbreviation has to be used. For correction of any entry, strike out the incorrect entry and one line of entry and corrected entry. This is one of the very important thing, that you have to use only one line. Suppose you have entered something wrong, you want to correct it, just put only one line. So tomorrow we can say that what correction you have done. Put your signature, enter the new corrected one, put your initial, your name and date. This is very, very important. Many people, they rub it and all, they wanted to completely make it that we are not able to see what actually was corrected. So correction in case record form is very important, and it has to be done exactly as per the guideline. Enter data in actually black ballpoint pen, because when it is done, it can be Xerox and will be having. Some people are using very light pen. Then when you are Xeroxing it, we are not able to see what is there. So it is always advisable to use a black ballpoint pen for actually entering the information into, and it should be very dark and very clear, so we can Xerox it and there is no loss of the impression. This is the standard completion guideline. I don't want to go into detail. These are available and one can download and check. Non-availability, not done, unknown. These are the normal abbreviations which are used in case of missing data. So these are some of the things which are there. One can go and check into the literature. This is another example of correct format. The date should be written like that. For each number you should have to provide the box. Similarly for the time, temperature, all those things should be made in a case record form. Similarly, this is the way the case record form sheet should be there, where you are entering the data, date, time or temperature, whatever parameter you are doing, it should be very, very clear, no confusion. Unit of measurement is very, very important, depend on what you are taking, actually blood pressure, or you are taking height, or you are taking weight. For example, you are taking height in centimeters. So we know that centimeter will be like that, 183, or you are using height in meter. In case of meter, we have got 1.83. So whatever actually measurement you are doing, you find out the unit and convert that unit into particular box, whether you need a 4 box, 2 box or 3 box. For example, age, the individual may be 100 years or 101 years. So there should be 3 box. Something like that you have to prepare. Example of few actually pages of case record form I am just showing here. This is the flow chart. What I was telling, it must be there, because this is actually washout period. We are including the patient, and this is before 3 days. So we have left, we have not given any drug. We have screened the patient, and this volunteer is now ready to come into clinical trial, and this is actually our washout period. This is the first week. We have got 2 treatments. As per the randomization, either he will go to treatment B. So the first week when he is coming out of washout period, actually drug administration start. Then the second visit is after 1 week, that is on the 7th day. This is second visit. Then 14th day is the third visit. And then I have got the last visit, that is 21 days. So the total duration of the study is 21 days. Washout period, treatment A or treatment B, depending on the type of protocol you should do. Inclusion criteria, please check all the statement and tick appropriate box. Morning stiffness. This is very commonly when you are evaluating a drug for rheumatoid arthritis. Ask him to put tick or not. If the answer is no to any of the above, please do not enroll the patient, because my requirement is that if patient is having morning stiffness, he includes my inclusion criteria. Otherwise, I am not supposed to include it. Suppose he says no, that means patient is not having active rheumatoid arthritis. I need not to include into clinical trial. Coming to exclusion criteria, pregnancy, lactation movement, all these things are there, childbearing, I want to exclude. Again, I will find out if they say yes, I cannot include. So depending on their answer, yes or no, all the answer actually should be yes for inclusion criteria, and all for exclusion criteria should be no to include the patient. So inclusion criteria and exclusion criteria, these are very, very important for choosing a participant to include into the clinical trial. Demographic data, you all know very well, I need not to tell: age, gender, weight, height. Concomitant illness and medication, they may be suffering with some other disease. You have to write everything, what type of disease they are suffering, what drug they are taking, how long they are taking, all those information should be entered into this particular form. Study medication dosing detail. Now you are giving a drug A or drug B. You clearly write actually what is dose, 50 milligram, 100 milligram, whether he should use once a day or 2 times a day. So study medication dosing detail should be filled in this part of case record form. Special examination, if it is there, then depending on the type, you have to do either there may be pain scale. Suppose you are evaluating a drug for pain, a very good analgesic. We use actually pain visual analog scale to analyze, or there is a inflammation like swelling, redness, local temperature. So for pain evaluation, we use a visual analog scale. So this is a spatial examination. When there is a spatial examination, then there is a spatial card. So this is visual analog scale which I used to use when I am evaluating a drug for the pain. No pain, he will put mark somewhere here. When pain is very severe, the participant will put it here, and then I will measure in centimeter. So this is the visual analog scale for me to evaluate the analgesic drug. So this is a spatial examination. Adverse event reporting, I don't want to go to detail because you have to ask everybody and follow that. Like nausea, yes or no. If it is yes, whether severe, what treatment has given, what concomitant. These are all well designed actually parameters which are available on regulatory actually website, and you can download, and you enumerate all the side effects which you think can occur in your clinical trial: nausea, vomiting, abdominal pain, anything, whatever there, you enumerate all, and then you put yes, no, severity and all those things. This should be a very important adverse event reporting form, should be enclosed in every case record form. Then actually serious adverse event form is very important, and there is a definite guideline and definite specimens are there. This has to be followed, because this is very, very important for rejecting the drug, and regulator and the ethics committee members, they are very particular or proper designing and using the serious adverse event form, because most important thing is that based on that the compensation to the participant is required, and it is one of the most important legal document. So one should be very, very careful in designing the SAE form in their case record form. The interpretation of handwritten entry, especially if they are medical term, microbial species, medication, should be easy. Whenever you are entering some medical term or microbial species and all those things, because there are different type of spellings are there, which may not be normal term. So one should be very careful in entry and try that it should be easy. Block capital are preferred than a script. Always, if possible, enter all your these things on block letters rather than just writing graphical. Graphical data must be minimized. Don't make very small graph, and because you may be understanding graph which you have made, but if it is coming to me, probably I may not able to understand the graph, what is the meaning of that. So please avoid putting a graph data in your case record form. Enter in block letters. Consistency in question format of question. This is very, very important. Always there should be consistency in your question format and how it should be answered. There should not be any variation. You should be very clear that if somebody wants to actually put that answer, what format you want that question format should be done. For example, you want which format should be used. Here is example that in this case record form I am telling that if yes, kindly circle. Somebody telling that okay, you do underline. Somebody is telling you put delete. Suppose this is not there, delete. So either you are asking them to put a circle or underline or you are deleting. This is the format. You have to clearly give instruction to those people what they should do. Most commonly what people they do, they ask that tick, cross or box. Now my question is there, should we use tick or should we use box? I prefer entering box, and I will give you the reason why I prefer box. For example, if there is a tick mark, suppose I say put a tick mark, he has put a tick mark. I can convert this tick mark into cross, but that use a code. If yes, enter 1. If no, enter 2. So these are the various ways actually people are using their format to be answered by the investigator or other people. So this format is very important and this should be clearly instructed to them that which format they should actually take the correct answer. Consistency in the question layout. When actually you are putting, clearly you should write. Suppose the age group you want, divide into different, not that writing that kindly write the age. I may be writing 35, 40. Better actually give a distribution, either in this form or it should be this form. Clarity of the question. The patient is not taking statin, yes or no. Is the patient taking statin, yes or no? So avoid the double negative. Don't put questions such a where is it difficult for the patient to answer. So always avoid a double negative question. Keep answer always positive whenever possible. Are you in a worse health than a year ago? Are you better health than a year? This is a better way of putting the question when you are asking a participant rather writing actually double negative. Section of completing by the participant. There are some actually part which actually the case record form or some sheet you give to the participant to fill it. Now let us see that what is there. Some part of case record form like questionnaire or diary card are completed by the patient. Suppose you are doing some studies like psychopharmacological effect or some other thing, you give a diary card and ask the participant to enter on that card. Following points should be borne in mind whenever actually you are preparing a questionnaire or diary which has to be filled by participant. What are those points? The font size should be more than 10, should be very clearly visible to the participant. Medical jargon should be bad. Don't use some medical word which actually participant, he may be a layman, he cannot read properly. To avoid, use a simple layman language. full example of each entry should be given. You prepare one example and put it there. So this is the example, and as for this example, kindly enter it. Give example there. Attractive and easy use of format should be used. Don't use some format which is very difficult for him to prepare it answer. Maybe tick mark or cross may be very good. Just put a box and tell if you are agree, put a cross mark. It's very easy. And by listing the potential symptoms, prompting him to understand what actually type of symptoms may be possible for him to develop. Text actually should be minimized. Please don't ask them to enter something, writing something there, because lot of mistakes they will be doing. So better as far as possible, don't ask any participant to enter any text in your actually diary or the questionnaire. Questionnaire should be just case, tick mark or something, very simple. Then actually designing guideline. This is for the designer when they are designing. Use well-known terminology and abbreviation. Every designer must actually go through and find out the literature internationally, what are the terminologies are used for a particular thing, and then you should use actually the abbreviation also. Don't use any terminology which is not commonly used, very difficult for anybody to understand. Remember that some terms have different meaning to different people. There are many examples where different terms have got different type of meaning for different people. Provide definition when necessary. Sometimes actually we use some term which is very difficult to understand by many normal educated people, because these are some very common medical terms. In that condition, provide a clear definition what you mean. For example, you are telling pyrexia of unknown origin. Pyrexia of unknown origin means fever where the reason is not known. Suppose you are writing pyrexia in unknown origin, he will not understand. So you should write, if you are having a fever where you don't know the cause, this is known as pyrexia of unknown origin. Or you say polyuria. He may not be knowing what is polyuria. You have to clearly write that if you are going for urination for more than normal, it is polyuria. Similarly, there are some terms are there which may be there. If it is there, give a definition. When a comparative judgment is required, define the basis of comparison. Suppose he has to compare between 2 or 3 things, color is there or size is there. Clearly you define when this is there, you write that mild, moderate, severe. What is mild? What is moderate? What is severe? So size you can put. If it is 1 centimeter, this is mild. If it is 3 centimeter, it is moderate. If it is more than 7 centimeter, it is large. So something like that you have to write. If you write mild, moderate, severe, I'll put mild for moderate. So whenever actually there is a comparison is there, color. So if there is a color comparison is there, you clearly define. If this type of color is there, even actually you can give a color sheet. Suppose you are doing some study where you are recording the color change of the skin. So better actually you can give a sheet having a 3 different color. This color number 1, this color number 2, this color number 3. So whenever something like is there, provide a comparative chart or comparative sheet along with the case record form. Then important thing is that a printer should be very careful to print a case record form, because it has to be kept for many years. When I'm just using, after some time, few pages are coming out because it is not properly printed, it is not properly bound. So printing requirement is also one of the very important component of case record form. It is essential that the printer should receive a very clear, absolute instruction of printing and assembling the case record form. You have to very clearly tell what you want, and there should be very good gap between where actually he is doing the binding and the writing part. Easily page can be open and we can write. Once we are opening, again page is going back. No, it should not happen. I should open very uniformly and it should not come out. So binding also should be done very effectively. Dimension of any artwork supplied to printer must be appropriate. You should not give very small thing to do that. Give a proper, which is optimum to be used, which is very clear, which is very, it not should be so big to carry and it should not be so small, it is very difficult to use it. It should be on optimum size. Allowance must be made for binding margin, which I told. Binding margin should be given very clearly, so I should be able to properly enter even at the point of margin very clearly. Now, actually, when you are designing the protocol, you are preparing the protocol, and we are working, what are the process of improvement? Because everybody is designing and preparing, and we do mistake and we do some of the things right. So there are some actually improvement process. First actually is that define your organization process for designing the CRF. After study completion, evaluate the document which CRF work well, which did not. So you have to find out whether particular your CRF has worked. After 1 or 2 case record form are completed, just check what you have designed, it is okay, or would you like to improve it? Get input from other involved CRF design inside, outside of your organization. Always give some CRF to some other people. Let them tell this is okay, this is not okay, this improvement has to be done. So these are some of the process you have to actually adopt for improving your case record form and prepare the best case record form for any clinical trial. I think this is, then sometime actually we are using e-case record form or actually data entry which we are doing electronic data certificate. This is actually always web-based. Many people are now going to the electronic database and clinical trial. So they have got 3 clinical sites. One is the investigator number 1. There is investigator number 2. There is investigation number 3. All these people, they actually collect the data onto the particular case record form, and they have got a case record form which can be entered onto the computer or laptop. All information by internet come into the center where actually it has recorded there. And then we have got the web server. Web server actually collects all information, prepare in a very solid document, and then it prepare a draft database, and that database actually goes for the analysis. So this is the way where actually we do the electronic clinical trial, or what we known as a electronic case record form. This is also very, very common. Many people are using actually paper case record form as well as the eCRF. What is similarity between eCRF and paper CRF? Both should be similar in design, since the layout and data flow should reflect the protocol. There is no difference. Both are very similar. The header information is still critical as it reflects the identity and integrity of the participant. So header is very, very important. For any case record form, header actually provides actually who is the participant, what is the actually case number, what is the protocol. So this is very, very important, whether it is actually eCRF or it is a paper CRF. What are the merit of actually eCRF? Data can be checked at a time of entry against appropriate field validation criteria, providing assurance of correct data entry. Very easily, actually, I can check whether data is properly corrected or not sitting in my home. Data management, validation, case bring us the data query form also can be checked. As the data is being entered directly into the centralized database, monitoring staff and data management person will be able to review the data more quickly and more easily. Now coming to demerit of case record form. It takes a longer time to design. It takes very time. You have to prepare and go on running and checking that whether there is some problem is occurring, internet is issues there. So designing and deep ECRF together with supportive database information technologies compared with designing and printing. So printing is very easy and we can distribute to the participant and they can enter. We need not to bother whether actually the internet is not working or something. So that is one of the demerit of eCRF. eCRF, unlike paper CRF, can have technical problems. Sometimes there are some major technical problem comes, data disappears. Then it becomes very difficult to dig out the data from eCRF. Sometimes data validation check is slowed down data collection process. This is some of the demerits which can occur when we are using eCRF. Now coming to the summary, to ensure quality data, apply CRF designing principle, determine the best time for designing the case record process, involve the right people, know the goal of CRF design, apply CRF design guideline. Always use the guideline abbreviation. Include the process of improvement which I mentioned as a part of CRF designing. Whenever you are designing a CRF, always include a process of improvement throughout the study and throughout the development. And search out for the sources. There are many sources where you get a very good guideline for developing a very good CRF, especially the ADR monitoring and actually serious adverse event, especially related to that country, or some new guideline which are required for doing clinical trial from that country is available. So search for all resources and then include into your case record form. So I think this is my final slide, and what I would like to say that the success is when your signature changes to autograph. So you should be very successful that your signature will become your autograph. This is your aim and you have to work for this aim. Thank you very much.
Thank you. Thank you, sir, for the live session. And it's very informative. We learned a lot about it.